Hi, everyone, and thank you for joining Ask Miss Jai Live. I am Miss Jai, and I'm really excited to be here with you to talk about what we're going to talk about today. um, if you are listening to me live, go ahead and put a hashtag live in the comments. Feel free to send me a wave. I'm really excited, as always, to bring this to you every Sunday. If you are joining us in the replay, go ahead and put a hashtag replay, and then let me know in the comments what you think was the most interesting part of today's conversation, or if you have questions or other things you want to talk about on Ask Miss Jai Live. Um, my name is Miss Jai. If you're joining for the first time, I bring you Ask Miss Jai Live every Sunday at 5 p.m. Arizona time, which right now is Pacific Standard Time. And on today's Ask Miss Jai Live, we're going to be talking about how to support our trans and non-binary colleagues. We're going to be talking about re-engaging patients and clients in care. And we're also going to be talking about how we can make sure that we are supporting uh, patients and clients from a holistic care standpoint. So we'll be talking a little bit about each of those things with our questions this week, and I'm really excited that you're here. So thank you for joining. And thank you everyone on Instagram who's waving so far. It's lovely to see you. Thank you so much, Ty. It's good to see you. And for the folks on LinkedIn and on Facebook, thank you for joining as well. So, how Ask Miss Jai Live got started because after working in HIV prevention and care for the last roughly 10 years, a little bit more than that now, um, oftentimes there were questions that would come up around how we could support trans and non-binary people, or there was a lack of information on how we could support colleagues or folks who were looking for services in our health environments. And so Ask Miss Jai Live is a way for us to answer some of those questions that come up most frequently. So if you have a question that you would like answered on how you can support trans and non-binary people, then you can go ahead and send that along to me. Either direct message me on Instagram, on LinkedIn, or on Facebook. And you can ask the question there, or you could ask the question below in the comments, and we will answer it on Ask Miss Jai Live. So the first question we have this week is, how can I help a trans colleague who is having a tough time with the work environment without overstepping? So I think it's important for us to remember that we are coming into the work that we do every day from our own lived experiences and our own lived perspectives. And we might see that someone is struggling in the work environment, or we might perceive that someone is struggling in the work environment, but that might not be their perception of the situation. So the first thing I would suggest is maybe checking in with that colleague and seeing how they're feeling, how the work is going, if they are needing any support, so that we're in that question of overstepping, so that we are not jumping to the conclusion that they must be struggling because of the way that we perceive their work or the way that we perceive what's going on with them. It could also be that what they're experiencing is unrelated to their work as well. I know that I'm someone that when my personal life is feeling really difficult or really challenging, it can sometimes be very difficult for me to step away from that in the work that I'm doing. I have to be very mindful about that. And so they may not have that skill, or they may not, they may be in a situation where their personal life is starting to eke in to the workplace as well. So it could be that there are a number of things that are actually happening. So checking in with the person first to see how they're feeling and if they would like any support is a really good first step to not overstep and just assume that they need your support. The next thing I would say is advocating with someone instead of advocating for them. So if I like to use myself as an example in a lot of situations. So, for example, when I started working in a hospital setting and was dressing femininely, I was on a floor where we were working as an infectious disease clinic, but there were other clinics that were present. So, there was like a cardiology clinic, there was a clinic that focused on liver functioning. So a couple of different clinics were present in the same space. So some of the folks that I worked with on a daily basis. Other folks were on rotations, or we didn't have any sort of rapport. They just sort of like saw me in the hallway. And so I had a challenge with folks from other disciplines. Laughing or pointing or making fun, including providers, like laughing and pointing and making fun of the way that I was dressing, or whenever I stepped onto the floor. And so something that my supervisor did that I really appreciated was that they advocated with me as opposed to advocating for me. So instead of going to those providers and as my supervisor and saying, "Hey, this is inappropriate," they checked in with me and asked me how they could support me and if they wanted me to have that conversation jointly or just have that conversation as a supervisor. And I felt it was important that I advocate for myself in that situation, but have their support as the supervisor. So checking in, but then also advocating with me as opposed to advocating for me or speaking for me around the way that I want to be treated in the workplace. And then I think it can also be really helpful for us to identify some outside resources. So I had and maybe bring those resources to the table for the check-in or for the team as a whole. And so a really great one is for folks who might be feeling isolated or who are kind of struggling, even if they're not experiencing like a crisis in the moment, is the Trans Lifeline. And the Trans Lifeline is run for and by trans and non-binary people, and it's to provide some support to folks who are experiencing crisis, but also provide some support to folks who are just experiencing challenges with everyday life. They just need someone to talk to who has similar experiences to them, or someone who's going to be able to empathize and connect in a way that can be difficult for us if we're not from that community, if we don't experience the world in the same way. And so providing that resource as as an alternative also helps us to then not focus the support on ourself as the person coming forward and saying, "I will help you, my colleague," and instead says, here are some ways that you can get some support also in the privacy of your home, where you can get some support away from the work environment, so that we're not hyper focusing on the fact that there's a challenge in the work environment specifically. And then I think it can also be really helpful for us to provide some opportunities for nuance and refining where there might be pain points or like pressure points in the work environment for our colleagues. So if that looks like, do we have extraneous meetings that are not necessary? Are those things that we can cancel or that we can push off or change into an email or a check-in or an update? If folks are experiencing Zoom fatigue, and so there's a lot of expectation that we be on camera and verbal and going to multiple meetings a day or multiple meetings throughout the week, is there a way that we can reduce those meetings, or is there a way that we can not have the expectation that folks have to be on camera in order to be present and participating? So there's a couple of different ways that that can be looked at as well. And then also recognizing that there are some nuances within health environments depending on where you work that can make it difficult depend for trans and non-binary folks in ways that cisgender folks don't experience. So if you're working in an environment that has a dress code that is expecting your clothing to match the gender that you're perceived as, or that is expecting your clothing to match the gender that is on your documentation as an employee, then that can make it more difficult for folks to feel like they can express themselves or for folks to feel affirmed in the workplace as trans people working in the health environment. And additionally, like it's similar if those dress codes include things like shaving, include things like hair length. I've worked in environments where masculine presenting folks or folks who were read as male or whose documentation said male were told they couldn't have long hair. So there's just some nuances that can happen depending on the actual work environment itself that can also make this very difficult for folks, or they might be feeling additional pressures because of their identity unrelated to the work that's taking place. And then I think it's also important for us to keep in mind that trans and non-binary people experience high rates of employment issue, or excuse me, unemployment. They have challenges in the workplace because of their identity. There's discrimination that's experienced because of identity, or being prevented from promotions, prevented from being able to have access to professional development. And that is even stronger. That disparity is even stronger for trans people of color, Black and brown trans and non binary folks, especially having this having opportunities not presented to them or not being given the chance to develop professionally in the same ways as white, trans, and non-binary people, or as in the same ways as cisgender folks. And so this could also look like, what are we doing in our work environments to make sure that if we are becoming gender affirming, if we are working on trans health, what are we doing in our work environments to make sure that when we inevitably have trans and non-binary employees in those settings, that we are setting them up for success and making sure that they are provided opportunities to develop professionally, and that we're investing in their development professionally as well. So I think there are a couple of ways that we can support our colleagues who are experiencing difficulties in the workplace. And I think part of some of those things can be individually how we can support, and some of those things can be structurally how we can support, and how we can change those structures to make sure that there is investment in us developing professionally. The next question we have is, how do I re-engage a patient or client who's exhausted with the healthcare system? So first, I want to acknowledge the language that's used in this question. So I think when I hear that someone ask about how do we re-engage someone who's exhausted with the health system, that also kind of tells me that the person who submitted the question, who's likely a colleague in healthcare, is also exhausted with the health system. So I think it's important for us to recognize when those things come in for us, because that means that that's going to that's the lens we're going to view the situation through. And so if we are exhausted with the health system as a provider and we're trying to engage a patient or a client, then it's going to feel additionally exhausting to try and get them back on board with their care. Um, so first, I want to acknowledge that. The second thing is that I think it is important for us as providers to the acknowledge the exhaustion, or acknowledge the burnout that a patient or a client is experiencing in the health environment. So our health environments are set up in such a way that we are really trying to standardize our care. We're trying to see as many patients as possible. In a lot of places, especially right now, we're experiencing shortages of nurses, we're experiencing shortages of providers, we're experiencing shortages of access to care. And so we have a large push and pressure to make sure that we are seeing as many patients as possible. And that ends up working for patients who have the least amount of chronic health conditions, the least amount of complexities with their health. And so if we're working with a patient who's experiencing burnout or is experiencing fatigue from the health system specifically, then that also tells me that this person likely is dealing with a lot of additional health concerns that are likely going unaddressed, or that they've attempted to address in the past and have been ignored. So I think it's important for us to acknowledge that and be honest with that around when we're speaking to this patient or this client, of like, it sounds like there's a lot of things that are going on for you. There are lots of health concerns that you have, and it sounds like you maybe are not having all of those addressed. Because I think acknowledging it as opposed to just ignoring it can go a long way, and just starting to build that rapport. And there can almost be this relief of like, yes, finally someone sees that all of these things are happening for me. The next thing I think that's important is that we are affirming what the person is looking for in their healthcare. So sometimes when we get stuck in the routine of how we're providing our care, or or providing services to folks, we might get stuck in this checklist mentality. So we have to get through this assessment. We have to do this paperwork in this specific way. It has to be done on these regular intervals. And if we don't do it, or we don't meet these metrics, then we're not providing adequate care. And sometimes I think that can get in the way of how we affirm someone's goals for their own health. And it takes us away from providing space to be more client or patient centered in that situation. So the ways that we can affirm that instead is by being clear with our patient or our client when an assessment or an evaluation or paperwork is necessary and why it's necessary, and also building in flexibility when there are health concerns or health needs or health goals that are going unaddressed, and those should really take priority. So yes, we need to do an assessment on on screening and making sure that you have dental care, and that you've gotten a colorectal screening this year, and that you've gotten a breast cancer screening, or whatever that looks like. However, is that addressing what your current needs are or what's brought you in for the visit today. And if it's not, maybe we start there. And then if there's time, we can go through the assessment. And I want to acknowledge and catch myself for just a moment because I just said the word breast cancer. And I think it's also helpful for us to move to more gender neutral language like chest cancer or chest screening, as opposed to breast, since breast also has a feminine connotation. And there are folks who have chests that require screening that don't use the language breast. So it's also like catching ourselves in these moments and recognizing when we can do better, when we can improve our language or improve the ways that we are owning these pieces. And then we can be inquisitive as well. So we can ask questions for folks about like what are their biggest health concerns? What are the ways that they would like this visit to go? How does someone know if this has been a successful visit or not? Like, how do they define a successful visit? Do they have the opportunity to just talk about all the things that they want to talk about? Are they getting resources and referrals? Do they want to leave with tangible pieces of what next steps can look like? What does that look like for them, and how do they define success? And then we can move from that patient or client centered, or move from that patient and client centered care model, so that we are meeting their expectations and their needs and being honest when we can't meet that expectation or that need. So if someone comes in and say, well, my model of success is that you're going to give me all the answers to my health questions, that might be unrealistic. I might be a general practitioner and I don't have answers that around a specialty medical care need, or I might be providing case management support and I can't give answers around the medication that they're taking and whether that medication is going to be counterindicated with other medications. So I think it's also being honest around what we have the knowledge base for and what we can actually provide. And then the other thing I think is that it's important for us to recognize what are our patient needs and how to balance those with our organizational expectations. So I mentioned just a minute ago that we might have an assessment we have to get through. I think about the when I was working in Ryan White funded programs, that we had to do a lot of paperwork in order to keep folks enrolled in that program, which was covering and subsidizing their medical care. But sometimes that paperwork got in the way of us being able to have a conversation around what case management could do for them and what case management could mean for them, and what their other health needs were outside of completing this paperwork. And so the way that I would approach that is I would inform folks whenever I started working with them around what some of those organizational expectations are. So we're going to be meeting every 6 months to fill out this paperwork specifically. During that meeting, we are just going to be filling out paperwork, or during that meeting, we are just going to be doing an assessment, or whatever that might look like. This is how it can be provided or done. You can do it on your own, we can do it together. You can do it on your own and then we can meet and see if there's anything additional that needs to be done, but these are the ways that it can look. And then outside of that, let's talk about what your health needs are. Let's talk about what the other psychosocial uh, factors are that you're needing support with. And I can work with you on those things outside of the every 6 months that we meet. And so it sets the expectation that we are going to be meeting with folks for very specific things during certain times, but to meet those organizational constraints or those organizational expectations, but that there are going to be opportunities for the patient or the client to really take the reins and lead the direction of what it is that they're looking for. And then I think it can also be helpful for us to start recognizing when patients are starting to get burnt out. So part of this is that preventative mindset as well, right? We're not just being reactive when someone has completely disengaged, but how can we start to identify it before folks become disengaged? So are we setting them up with lab work and they keep missing lab appointments? Are we setting them up with appointments and they keep missing appointments? Are we providing them with referrals? Are we providing them with referrals multiple times to the same specialist or the same organization, and they haven't followed through with those? Those are opportunities for us to have conversations with that patient or client and find out more information around why there's challenges with that linkage, because those might be indicators that a person is becoming overwhelmed or burnt out from the health system, or that this is the third time I've gotten a referral for a a podiatrist, and every time I've been referred, the provider says they can't do they can't help me at all, and they just try to refer me somewhere else, or that's the end of the visit and I don't know what the next steps are. So it could be that there are a variety of things that are going on, and someone might just be kind of over it at that point. So if we start to see those pieces, then we can have those conversations of like, it seems like it might be difficult for you to get to the lab. What are some ways that we can make that easier for you? What are some ways that it could be less challenging? Do you need to go to a different lab? Would you like us to help you call and schedule an appointment? Is it a challenge of financial coverage? And do we need to space out your lab work so that it's not as frequent as per medically indicated? So there's a variety of ways that we can then address that and work together to try and figure that out. Another piece of burnout that I see also is when folks have multiple providers and those providers aren't communicating with one another, especially when those providers are in the same system. And so I think it is part and parcel for us to do our due diligence that if a patient has multiple providers for multiple health needs, that we are taking the time and in preparation for that visit to at least review the most recent physician note from ourselves to remind us of what's going on with this patient, but also the most recent physician's notes for the other providers that the patient is seeing, because likely they saw those providers in between when they saw us last. So that's for folks who are maybe working in a setting where there are multiple providers housed under one, like maybe a hospital setting, or if you're working in a case management agency where that client might be coming into contact with multiple case managers or across multiple services, then that can help to give you some better idea of where the person is interfacing with the organization and how we can support or reinforce that those services are available for them. And I'm seeing that there is a comment, but I can't read it. But hello, Diana. Thank you for joining us. Unfortunately, I can't read it right now, but I will read it in just a moment. So the third question that we have for today is, how do I make sure a health provider will take care of all my needs and not just bits and pieces? So I think that this leads very well from the last question, because this is talking about someone who might be experiencing multiple health providers, someone who might have multiple health needs, um, and maybe is starting to feel like they're shuffled around the health system, uh, either pretty frequently, or they have to see a primary care provider and then are sent to specialists and feels like there might not be communication happening amongst those as well. Or that someone has health needs that can be addressed by a primary care provider and is instead sent to a specialist. So we see this sometimes with folks who are managing hormone replacement therapy, not the initiation of that hormone replacement therapy, but just management of it. There are lots of general practitioners and primary care providers who can manage a hormone regimen and lab testing and things of that nature. And then there are also lots of folks who are general practitioners or PCPs who are uncomfortable with that and refer to specialty. So there's lots of ways that this could potentially look for folks. There's really two parts or two sides to this. There's the patient side and there's the provider side. So I'm going to talk to the patient side first of some things that as patients we can do to make sure as many of our health needs as we have are being addressed by our providers. And then I will make some recommendations for providers on ways that we can reinforce that as well. So, as a patient or a client, one of the things we can do is we can come prepared for our visit with a list of questions and a list of our health concerns. So, this could look like questions around lab work. It could look like questions around this. You mentioned this word last time, and I don't really understand what that meant. Can we talk about that some more? It could be questions around uh, if this is the first time that you're meeting with a provider, it could be questions around how do you provide your care? What is an expected like return to care look like? Should I be meeting with you once a year? Should I be meeting with you 3 times a year? What does that look like for you? What does that look like for other patients or clients? It could be asking a provider what their approach to health is or their approach to care for an individual. Do they look at it as collaborative or do they look at it as a top down structure? Will they be providing resources and documentation and paperwork, and then expecting you to read over it, expecting you to ask any questions if you have any questions? Or will they be checking in with you again at the next visit? Or will they be checking in with you in 3 months via phone? So these are great questions that we can ask to get a better understanding of where our expectations might look, or what our expectations might look like in engaging with care with this person or this provider. And then if we have specific health needs that we're concerned about. So if it's been a while since we've had an A1C check, and we have diabetes in our family, or we were pre-diabetic, then we can ask questions about that and getting those needs met. If we've been having abdominal pain, then we can ask questions about those. So coming with a list of questions can be super helpful in just focusing the conversation, and also making sure that as a patient or as a client that your needs are being met. The next thing is that we can also express our own expectations on what health support looks like, and what we're hoping for, or what we anticipate for from a provider, what we need. So it might look like we've asked questions, and now we understand that you, as the provider, this is what you this is how you like to approach your healthcare. Well, I'm going to tell you what my expectations are. My approach to healthcare, with a provider, is collaboratively. So I anticipate that we'll sit down and we'll talk about what options look like. And then, as the patient, or as the client, I'm going to direct which option feels the most comfortable with me, or for me. So I think about this also with things like medication for behavioral health, and the ways that we might have conversations in therapy around what are our thoughts on medication? What are our thoughts um, on taking something to stabilize mood or anxiety or depression? And so we might have more conversation first, kind of leading up to and testing the waters for one another around what this looks like for us, and how we may or may not be comfortable taking medication. And then the provider responds to that. So it's helpful when we set up what our expectations are in that situation. And then finally, as the patient or client, I think it's really helpful for us to shift or maintain a mindset that is collaborative in the healthcare, in the care that we are trying to receive. So if we come into the situation and um, we're really forceful, we have really strict, it's my way or the highway, I'm as the patient, it can be very difficult to collaborate, with the provider and get our health needs met. And so I think it's important that we advocate for ourselves, and that we are saying what we need. And also, we don't want the way that we are approaching the situation to result in our message not being heard, our expectations not being heard, or our healthcare not being addressed. And so I've also seen situations where patients or clients have come in with a set of questions, and they've been really intense and focused right out the gate. Instead of saying, like, I brought these questions, I'd really like to have these questions addressed today, they've just launched into the questions and then kind of like steamrolled. And that's resulted in providers, writing off patients as combative or disgruntled or challenging or difficult. Um, and ultimately, what ends up happening is that, because that bias now exists, it's going to be harder for you to get your healthcare needs met. So I would encourage you to approach from a collaborative standpoint, where you are, um, walk into it almost like you are sitting down to talk to, a friend, or a work colleague around addressing a challenge in the work environment. So you could be sitting down, and you could say, "Hey, this is the thing I want to address. I want to address this health condition or this health concern that I have. How can we work together to address this health concern? So I'm really concerned about my blood sugar levels. How can we work together to address these blood sugar levels? What are things that you can provide me as my provider, and what are things I can do on my own in the interim to make sure that this concern is getting addressed?" So that can be a helpful way for us to approach it, is collaboratively. Now, for providers, I think a lot of what I'm going to share just reflects and mirrors a lot of what was shared for patients. So I think it's important that as providers that we are prompting patients to ask these questions. So asking patients about their concerns, what brings them in. Generally, what I hear is like a "What brings you in today?" and it might be one succinct thing, because been trained as patients and as clients to be really succinct, to address only one thing at a time, and to not um, and really not to complain. And so I think instead having a more organic conversation around not just what brings you in today, but what are your most pressing health concerns? What are the top 3 things about your health that you would like support around? Even just changing that language a little bit can automatically change the way that we're going to engage with you as a provider, because I think so frequently we're asked, "What brings you in today?" And we really don't have an answer because it's a general checkup, or we're like, "Oh, well, this one thing is what's bringing me in today." And we might actually have a couple of things that are going on, and they're all interplaying with one another. So that would be the first thing that I would suggest. The second thing would be to be honest about what you can and cannot provide. So we can't be all things to all people as providers. Whether you're in a medical setting or you're in a social services setting, we can't be all things to all people. We have limitations around what our services can provide. We have limitations around our funding. We have limitations as human beings and our own understanding of whatever topic we're working in versus topics that are outside of our scope and understanding. So I think being really clear on what we can and cannot provide then allows the patient or the client to fine tune their expectations and also come to the table with health concerns and health needs and questions that are related to the pieces that we can provide support to. So as a case manager, I could help with navigating financial situations. I could help with navigating getting coverage for insurance. I could help with navigating getting any challenges they were having with at the pharmacy, getting their medication. But what I couldn't help with is I couldn't help with um, housing services. I could link them somewhere and I could refer them somewhere, but our organization didn't have housing services. We didn't have vouchers. We didn't have any money set aside to specifically help with a housing based need. So even though we know that that's connected to health, even though that might be the most pressing concern for the person, I was clear in what we could and couldn't provide, and then offered resources and referrals to try and get that person to get those needs met. But that person then also knew to not come to me and expect that they were going to be walking away with the money to cover their rent that month, or with a voucher for a motel or a hotel. So we have to be really clear in what we can and cannot provide. And so one of the things that I just mentioned is my next suggestion, which is offering resources and referrals. So part of that is vet your resources. So if you are going to be, if you know you're sending folks to housing services frequently or shelter services frequently, have you contacted those organizations to see what their policy is on sex segregated or gender segregated services? So are they shelter services only for folks who are cisgender women? Are they housing services that are only available for folks who are able to be placed into a shelter for men or a shelter for women? And if they're being placed into those shelters, is it based off of their current legal gender marker, or is it based off of their current gender? So vetting our resources before we refer someone builds trust and rapport with our trans and non-binary patients or clients. And it also shows that we, to some extent, recognize that it's not as simple as I'm going to give you this resource, you're going to be able to go and get that resource. Because as trans and non-binary people walking through this world, it's never as simple as I'm going to walk in the door and I'm going to get services, because walking in the door itself can be terrifying. Getting to the door can be terrifying, and we can experience violence and harassment and discrimination. And the way that some services are set up are inherently discriminatory towards trans and non binary people. So if we vet our resources before we send someone over to those resources, then we are showing the patient or client who's sitting in front of us that we that we care, and that we also understand that there's more that needs to take place in order for them to get their needs met. And we're not sending folks to a place that's going to ultimately end up as a dead end, or where they're going to experience more harm. And we're helping to prevent that harm from happening, and making a situation that is already challenging or has already been harmful worse. And I would say that that's the same for if we're in a medical setting and we're referring to specialty, or if we're referring to other folks within our agency, that we're making it really clear, this is the gender identity of the person. These are the pronouns that they use. This is the name they go by, regardless of what is on their legal documentation, and making sure that we are clearly delineating that as well. So if I'm working on that same floor I had mentioned at the beginning of this call, where I'm in infectious disease, and then I have folks who are working in cardiology near me, and I refer to the cardiologist's office, then I'm going to make sure in that referral and the documentation that is being sent over, that it it is clear that there's some way to denote the gender identity of the person, or the pronouns of the person, or I might use those pronouns in the documentation, and their current legal name, because that's going to be important for their insurance information, and their current name, if that is different from their legal name. So there's a variety of ways that that can look as well. And then the final piece that I'll say around this is that it's important for us as providers to also approach healthcare in a collaborative way. We should be taking a patient centered approach, or a client centered approach, in the ways that we are addressing services, because at the end of the day, regardless of how we feel about the health system, the person that is coming to seek services with us has to walk out of that office and still live their life and be in their shoes. So we might meet with them for 20 minutes and talk about their health needs. We might talk about their blood sugar levels, but as soon as that visit is over, this person is out in the world walking around, and they're still having to deal with their blood sugar levels. So it's beneficial for us in order to make sure that we are providing the best levels of care, and it's beneficial for the client or the patient if we take a patient-centered approach and make sure that their health needs are being met, and that the suggestions and recommendations and options that we are providing to them, and the ways that we're choosing to move forward, are directed by the patient or the client, because they're more likely to actually then follow through. And then, in terms of a collaborative approach, I think it's also important that we're taking an informed consent approach. And I don't mean just they filled out paperwork to understand that there might be risk associated with a surgery or a procedure, but that we are asking permission to touch a patient or client before we touch them. That before we do a heart check or a lung check, we explain what we're going to do and why we're doing it, and then ask permission to place a stethoscope on them, ask permission to touch their back, because there are a variety of ways that trans and non-binary people have had their autonomy stripped from them in health environments, um, from the ways that we've been pathologized, from the ways that we have been treated as oddities, from the ways that we have been treated with scientific rhetoric, or dehumanized because of our identities. And so we want to make sure that when we are providing these services, that we're doing everything that is possible within our power to not perpetuate that scientific dehumanization. And one of the ways that we can do that is by making sure that we are taking an informed consent approach, and asking permission before moving into these spaces, asking permission before we do an assessment, asking permission before we ask questions that are sensitive. So these are all the ways that we can provide support. And I think if we start implementing some of those ways as providers, and as patients, we start to follow some of those suggestions as well, then we are more likely to have more pieces of our complex medical human condition addressed, than feeling like we're being siloed into these individual pieces. So those are my suggestions. I want to thank everyone for sticking around today. Thank you for these wonderful questions. Like I said before, my name is Miss Jai. I am really excited to be able to continue to provide these Ask Miss Jai lives every Sunday at 5 p.m. Pacific Standard Time right now, but I'm in Arizona, so that will shift later in the year. But as of right now, it's 5 p.m. Arizona time. I'm really excited to continue to offer these to you. I do want to announce that there is a free training that will be taking place on September 30th. That training is called How Every Health how every health provider can create transgender and non-binary inclusive clinics. It's available for health providers of all disciplines. It's not specific to a medical environment. So if you are not in a clinic, but you're in an organization that provides social services or health services, then this is available for you as well. It will be on September 30th at 12 p.m. Pacific Standard Time, and it is available for free. You just have to register. So I'll put the registration link below in the comments. And for anyone who registers for this training, at the end of the training, that you'll have the opportunity to enroll and get early access to an 8-week course that I'm going to be launching in October that is limited to 25 people who are working in health environments. And we'll go through these suggestions and these tips for creating inclusive health environments in more detail, and then we'll allow opportunity and activities to critically review our own health environments and make action plans around how we can change those things. So very excited about that course, which is going to launch in mid-October. Very excited about the free training that will be available on September 30th. Please register in the comment or in the link below. And until next week for Ask Miss Jai Live, thank you so much. And thank you again for investing in the health and well being of trans and non binary communities. I hope you have a great week. Bye bye.